So I want to welcome you all and thank you again for joining us for our presentation, specifically for providers who are authorized to treat workers' compensation patients. Today, we are going to be sharing some of the latest updates on several initiatives that are helping to make the board better for healthcare providers and the workers' compensation system overall. I am Adam Rossi from the Stakeholder Engagement Unit here at the Workers' Compensation Board. Joining me today is Dr. James Tachi, the board's medical director. Also on hand are Audrey Cunningham, Christopher Failing, and Eileen Moss from our medical director's office. And they will be on hand to answer your questions today. That though, we want to go ahead and get into today's presentation. But before we do, we would like to thank you for choosing to treat injured workers in New York State. Having more treating providers means New York's injured workers have more options and better access to high-quality healthcare. As you may be aware, the board has been working toward making the workers' compensation system better for injured workers, better for businesses, and better for healthcare providers through several modernization efforts that improve stakeholder interactions within our system. Over the past few years, we've undertaken several initiatives to improve healthcare and enhance the experience of treating providers. We continue efforts to make it easier than ever for board-authorized providers to be part of the workers' compensation system, and we will continue to share progress with you and ask for your feedback and input as we move forward. During today's session, we'll start off with some recent updates regarding workers' compensation weekly benefit rate, delegated credentialing, and the workers' compensation fee schedules. We will then review what you can do as a board-authorized provider in the New York State workers' compensation system. We will also be reviewing updates on telehealth, which are now a permanent part of the workers' compensation system. And then following that, we will have a few updates regarding Onboard, which is the board's business information system. We'll touch on the workers' compensation New York medical treatment guidelines, known as the MTGs, and as well as the trainings that are available for those. We'll briefly update you on the board's transition to the CMS 1500 form. Then we also want to remind you of some things to be aware of regarding workers' compensation and COVID-19. And then, as I mentioned, we'll be sharing some resources and then take your questions at the end. We would like to start, however, by reminding you of the recently announced maximum weekly benefit for workers' compensation for the 2024-2025 fiscal year. The maximum weekly benefit rate for injured workers is 2/3 of the New York State average weekly wage for the previous calendar year as determined by the New York State Department of Labor. The Department of Labor reported to the Superintendent of the Department of Financial Services that the New York State average weekly wage for 2023 was $1,757.19. Accordingly, the maximum weekly benefit rate will be $1,171.46 for compensable lost time for workers' compensation claims with dates of injury during the period from July 4th of 2024 through June 30th of 2025. News here, the board now offers a delegated credentialing. This allows hospitals to submit an electronic file of medical staff credentialing data as a board application for authorization for multiple providers at once, rather than individual providers submitting multiple individual applications with redundant information already collected by the hospitals. Delegated credentialing is open to the provider types eligible to be authorized to treat injured workers, and any interested hospitals should contact the board's medical director's office at mdo@wcb.ny.gov for more information. We'd like to let you know that the board recently updated the New York State Workers' Compensation Durable Medical Equipment Fee Schedule. On December 8th of 2023, the chair proposed amendments to section 442.2 of Title 12 in the New York Code of Rules and Regulations to update the DME fee schedule. The notice of proposed rulemaking was published in the December 20th, 2023 edition of the State Register. The public comment period has closed, and the board is preparing a written response. The current DME fee schedule can be found on the provider section of the board's website at wcb.ny.gov, along with the proposed updates. And the board also plans on updating the New York State Workers' Compensation medical and dental fee schedules within the coming months as well. So please stay tuned for updates on those. Now let's quickly review what board authorized providers can do within the New York State Workers' Compensation system. This chart on your screen highlights which types of treatment each provider can provide. And we do want to note that this chart was recently updated to include telehealth treatments, which we will review very shortly. But you can view this chart on the expanded provider law section of the board's provider page at wcb.ny.gov. So as I just mentioned, we're now going to go over telehealth. So in July of 2023, telehealth became a permanent part of the New York State Workers' Compensation system following the adoption of a regulation that was many months in the making, with several iterations and rounds of public comments. We are very happy to now have this in place, but we briefly want to share how we got here and what it means. In New York State, telemedicine was an option before COVID-19, but it was limited to phone calls to discuss test results in lieu of an in-person visit and within a finite time window. During the pandemic, emergency telehealth regulations significantly increased the permissible uses of telehealth on a temporary basis to ensure continuity and access to care. Emergency regulations were extended multiple times. A 2021 study by the Workers' Compensation Research Institute found that telemedicine is changing the way healthcare is delivered on a national level. The new permanent telehealth regulations took effect on July 11th of 2023, following the expiration of the last set of emergency regulations. So now let's dive in some more for details surrounding this new permanent telehealth regulation. The regulation states that telehealth appointments may be performed by physicians, podiatrists, psychologists, nurse practitioners, physician assistants, and licensed clinical social workers through two-way audio and visual or audio-only communications. The provider must also be available for an in-person visit within a reasonable travel time if necessary. An in-person visit may be required as specified in the MTGs or based on the clinical age or stage of the condition, which is as follows for MDs, DOs, DPMs, NPs, and PAs. It would be the initial visit, every third visit, whether acute or subacute, every 3 months if chronic but not at MMI, or annually if chronic and at MMI. For psychologists and licensed clinical social workers, telehealth should be permitted for the first and subsequent visits, including group therapy, irrespective of clinical stage of condition. Remote behavioral health visits should be limited to situations when there is no benefit to in-person services versus remote services, or when an in-person office visit poses an undue risk or hardship on the patient. The reason for the use of a remote telehealth visit should be documented with each use of a telehealth visit. Treatment may not be rendered via telehealth for chiropractors, acupuncturists, physical therapists, or occupational therapists. Telehealth appointments that have been scheduled prior to the effective date of the new permanent telehealth regulation do not need to be changed to in-person visits in order to conform to this regulation, and the use of telehealth should not be the sole basis for challenging the results of such visits. However, any appointments scheduled after the July 11th, 2023 effective date must conform with this regulation. The regulations also delineate various clinical scenarios that indicate an in-person exam may not be necessary, such as routine follow-up appointments after a comprehensive initial in-person exam has already been conducted, or to discuss test results and or counsel on any clinical options. And when an in-person exam is necessary, such as to perform procedures, emergencies, eye conditions, any nuanced or complex issues, or when an in-person physical exam might reasonably impact the accuracy, quality, or certainty of the assessment, treatment, or recommendations. Some scenarios do require an in-person visit. They include, but are not necessarily limited to, urine drug testing, appointments to determine permanency, impairment, or disability, initiation of a chronic medication, or if the patient lacks the technology, capacity, or the desire for the telehealth visit. We are frequently asked whether independent medical exams can be performed via telehealth. It should be first noted that technically IMEs are not considered treatment. With respect to performing IMEs remotely or virtually, it is permissible if all parties agree, and if the IME is not being performed to determine permanency or permanent impairment. So now we would like to update you on the board's new business information system onboard, one of the largest modernization efforts at the board to date. Since its launch in March of 2023, more than 1.6 million prior authorization requests have successfully flowed through the system. And today, healthcare providers and insurers are using Onboard to request and review prior authorization requests for medication, durable medical equipment, and treatment or testing. And again, we have hundreds of these PARs successfully flowing through the system each day. More than 55,000 healthcare providers have registered for Onboard, and nearly 50,000 delegates have been added. 100% of medication, behavioral health, and DME PARs are resolved within 3 days, and most other PARs are resolved within approximately 30 days. Approximately 95% of these are resolved at a level 1 or level 2 stage of review, meaning without escalation. Over the course of the year, or I should say almost 2 years now, the board has made more than 75 system enhancements in direct response to feedback from healthcare providers and other users, so we greatly appreciate that. Lastly, the board has reduced the backlog of level 3 PAR reviews from over 8,000 down to 0. Over the past year and a half, the board has been steadily working to reduce the level 3 PAR review backlog, using data to identify problem areas, implementing new processes, and adjusting staffing resources. So thanks to this effort, every level 3 PAR review is now handled within 2 to 3 weeks. On your screen here, you'll see a quick breakdown of all the PARs submitted in Onboard to this point. We do want to note that the submission of MTG confirmation PARs is completely optional for healthcare providers. Treatment for a given condition that a provider knows to be specifically recommended by the MTGs is pre-authorized and does not require a confirmation PAR, except for those relatively few special services for which a special services PAR is required. So how has the board made workers' comp better for providers? There are several benefits here. Onboard provides increased accuracy, paperless transactions, and a user-friendly interface for interacting with insurers and with the board. Healthcare providers can now request board action on unpaid medical bills through the submission of Form HP 1.0 to ensure accuracy and timely receipt. We also allow electronic submission for PARs for treatment, medication, and DME. PARs for complicated and or invasive medical procedures, otherwise known as special services, may also be submitted. Onboard eliminates the confusion on which forms to use, and all submissions are automatically routed to the correct party with a time and date stamp. Within Onboard, authorized providers can assign delegates, such as your office support staff, to help you work within the system. Assigning delegates can assist you by drafting and submitting PARs, monitoring dashboards for insurer responses to PARs, drafting and submitting Level 2 medication PAR escalations, drafting and submitting PAR escalations to Level 3 for the medical director's office review, responding to insurer requests for information, and drafting and submitting Form HP 1.0. As of February 8th of 2024, delegates can now submit PARs and escalate Level 2 medication PARs for review. Previously, delegates were able to draft both, but were unable to submit or escalate. We do want to note that the board strongly advises against a pharmacy employee, a DME vendor, or a medical supplier serving as a delegate of the provider or the prescriber to prepare PARs. We believe that for most workers' comp prescriptions, the prescription writing is outside the scope of practice of a pharmacy or a medical supplier or vendor. Moreover, even if it were within the said scope of practice, we fail to see how the pharmacist or the supplier would have enough direct knowledge and understanding of the patient's clinical history and status, or even direct access to the provider or prescriber to appropriately recommend and or provide medical justification for a PAR. Finally, we believe that such a relationship runs a very real risk of the pharmacy or the supplier or vendor and the provider or prescriber from running afoul of state and federal anti-kickback laws. So for more information on Onboard, including a registration guide for healthcare providers, as well as some trainings, you can visit our Onboard website at wcb.ny.gov/onboard. We would like to also note that delegates cannot do the following. They cannot accept the electronic submission partner agreement, register within the medical portal, or report on a provider's status. The board has also introduced updates for Form HP 1.0 submissions. As of February 8th, 2024, the attestation required as part of a submission of Form HP 1.0 has been updated. Also, previously in Onboard, Form HP 1.0 submissions that are flagged as a duplicate present a warning message to users. This warning message alerted users if the form was previously submitted for the same dates of service, and users were able to continue submitting the form regardless of this warning. However, we've updated that now, so to prevent duplicate submissions, a new alert now appears for users attempting to submit a duplicate submission. The first alert will flag that this may be a duplicate submission, and users can select OK to continue with their submission. However, if it is a duplicate, users should select Exit and then return to the dashboard. The board has also updated the medical billing disputes section of the website to outline required documentation, the arbitration process, arbitration scenarios, and recommended actions for both payers and providers. There's also FAQs and more information as well. On the board's website, you can visit the provider quick link at the top of the homepage and then select medical billing disputes on the billing card to view these updates. Once your PAR is submitted, the insurer has a set number of days to respond. Response requirements vary for certain PAR types. Responses for MTG confirmation are required within 8 business days. MTG variants and MTG special services responses are required within 15 calendar days, but the response time is extended to 30 days if an IME is requested. Non-MTG over $1,000 responses are required within 30 calendar days. Non-MTG under or equal to $1,000 responses are required within 8 business days. And medication and DME responses are due within 4 calendar days. For medication and behavioral health PARs requiring level 3 review by the MDO, the overwhelming majority are resolved within 1 to 2 business days, and all are resolved within 3 business days. We do want to note that there is some variation on response times with weekends and holidays. You can visit the provider overview page at wcb.ny.gov/onboard/providers to see the PAR review section in the overview tab. You can also review this chart here you see on your screen on the provider page as well. We are often asked how providers can expedite the PAR process. So here are a few helpful tips to receive timely responses to your PAR. First of all, you might make sure you submit the correct PAR type. Submit supporting documentation, which includes any relevant diagnostic imaging and/or testing reports with the original PAR submission, and do not merely refer to the medical record. Use the MTG lookup tool located in the medical portal, or copy and paste your MTG reference for the requested clinical intervention and include a copy of the result with your PAR. Check, or you can have your delegate check, the onboard dashboard regularly for insurer responses and request any level 2 or level 3 reviews in a timely manner. Also, respond timely with additional information when the carrier initiates a request for further information in the system. Include a clear clinical rationale for the request in the medical narrative section, clearly stating why a variance from the MTGs might be necessary. When escalating a PAR to a level 3 MDO review, include a rebuttal that addresses the insurer's level 2 denial rationale in the escalation reason field, rather than simply copying and pasting previously provided clinical. Use appropriate MTG reference codes and only use none when the MTGs do not address the specific treatment being requested. Lastly, include the frequency and duration, if applicable, for the proposed treatment in the medical necessity field, and if the request is for post-operative therapy, include the date of surgery. We are happy to note that frequency and duration are now available as drop-downs when physical modalities are selected, so that's fun. And lastly, we would like to remind you that it is important to keep your information up to date with the board. The board does not distinguish between never authorized providers and those who lapse in authorization. Healthcare providers must renew authorization every 2 or 3 years, which is typically at the same time you renew your registration with the New York State Education Department. However, this is a separate and distinct process. Sometimes things change, such as during that period, such as your address, your phone number, your email, so we just want to make sure we have everything up to date. To update that information, you can log into the medical portal. Under the medical provider section, select either New Provider Authorization Request, Authorization Renewal, or Update Authorization Information. It is important to note that providers must renew their authorization every 2 or 3 years. The renewal of a provider's authorization will coincide with that New York State Education Department license registration renewal. To streamline the process, the board has transitioned to a fully electronic online renewal process through the board's medical portal, and the board will notify you about 60 days in advance of the providers needing to review. Now we're going to speak briefly on the New York Workers' Compensation Medical Treatment Guidelines, known as the MTGs. So as you know, in May of 2022, the board updated all existing New York MTGs, and the new MTGs were also added. Any newly authorized providers who are on here with us today, we do want to share some quick background on the MTGs. So in December of 2010, the board implemented legislatively mandated MTGs that fundamentally changed the delivery of healthcare to injured workers. The MTGs initially included 4 evidence-based guidelines for the treatment of injuries involving the neck, back, shoulder, and knee. These became the mandatory standard of care for days of service on or after December 1st of 2010. Then on March 1st of 2013, the carpal tunnel syndrome MTG and updated versions of the then existing MTGs including a new maintenance care program, were adopted. The non-acute pain MTG, as well as updated versions of the existing MTGs, were implemented for dates of treatment on or after December 15th of 2014. We do have MTG trainings currently available for medical and non-medical professionals. In collaboration with the Medical Society of the State of New York, the board recently updated all existing training modules and completion certificates. Each of the 16 MTGs has an associated online training course, enabling you to take the courses you want when you want to take them. Each training provides an overview of the general guideline principles, conditions associated with the body part or disease, and treatment recommendations. As an added benefit, there are opportunities to obtain complimentary CME accreditation upon completion of each course for those who qualify. There are also non-CME trainings for staff who would benefit from the training, but do not need or qualify for the CME credits. To access these trainings, you can visit the board's website, navigate to the healthcare provider section in the middle of the homepage, select the medical treatment guidelines link. From there, you select the training link on the right side of the page. The MTGs effective for treatment as of May 2nd of 2022 are listed here on this slide. And please visit the medical treatment guidelines section of the provider page on the board's website for more details. You can access full details on the new and updated MTGs, including a PDF of the respective MTGs, by selecting Providers on the top of the homepage, scroll down to Resources, then select Medical Treatment Guidelines under the Treatment section. Finally, just a reminder about the availability of the MTG lookup tool in the medical portal. The MTG lookup tool allows users to quickly determine whether a particular condition or treatment or test combination is recommended, not recommended, or conditional according to the MTGs. This does not constitute a prior authorization, but it can be submitted as part of the PAR process. When a treatment or test name is selected, the relevant section of the full MTGs for that condition will display. This online tool will help speed treatment decisions and ultimately provide more effective and efficient care for the injured worker. The MTG lookup tool also has a feature for use by providers that produces a verification summary document that confirms a lookup was completed, provides treatment recommendations for that condition, and displays patient-specific case information. This document can be kept by the healthcare provider or attached to any request for services, so for example, a PAR, or medical bill being sent to an insurer as verification that the treatment adheres to the recommendations set forth in the MTGs. The MTG lookup tool is available for all of the MTGs, and you can access the medical portal and the lookup tool on the board's website at wcb.ny.gov, and then select Medical Portal from the Online Services menu at the top of the homepage. As the board continues modernizing and improving stakeholder interaction within our systems, we would like to look back on our official transition to the CMS 1500 form, which is the Universal Medical Billing Form, which was implemented nearly 2 years ago. Since July 1st of 2022, the board has received over 10 million CMS 1500 form submissions, including nearly 3 million electronic submissions through an electronic submission partner. More than 11,000 providers have submitted their CMS 1500 forms through an electronic submission partner. The board transitioned to the CMS 1500 to reduce the administrative burden on participating providers who previously had to use separate board-specific forms for their workers' comp patients. Since July 1st of 2022, healthcare providers have been required to use the CMS 1500 for all workers' comp medical billing. Electronic submission through an electronic submission partner is strongly encouraged. As part of the initiative, use of prior medical billing and reports, including the doctor's initial report, which was Form C4, and the doctor's progress report, which was Form C4.2, have been discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. We'd like to note that provider types who are not permitted to opine on causal relationship or level of impairment are not required to submit this information. The medical portal provides access to all the online services the board offers, including electronic submission of medical bills to ensure insurers and the board. Once you have accepted the terms of the XML submission agreement, you can then discuss the details of submission with an approved electronic submission partner. To do this, after logging onto the medical portal, providers who have not already signed up for electronic submission will see a link which would say Agreement for XML Submission of the CMS 1500 under the billing section. You can see that on your screen there. Select that link and then select the I accept button. The provider's name will be added to the listing of providers authorized to submit electronic data, and that is updated daily. Once accepted, that link will no longer appear when you sign in. Ease of bill submissions, the board strongly encourages electronic filing of all CMS 1500 forms. This can be done, as we stated, by partnering with an electronic submission partner. That electronic submission partner will ensure that the medical bill and narrative attachment are sent and accepted by the correct insurer. When partnered with an electronic submission partner, providers do not need to complete a CMS 1500 form, but rather submit their bill and narrative attachment to the electronic submission partner that they have a relationship with in the agreed upon format. The electronic submission partner will forward the bill and the narrative attachment to the insurer. The insurer will accept the CMS 1500 form from the electronic submission partner and then return an electronic acknowledgement of receipt. The electronic submission partner will also forward the acknowledgement, including the receipt date, to the provider. Electronic submission partners will transmit the billing data, including the payer's acknowledgement of receipt, the CMS 1500 forms and medical narrative attachments, and the payer's acknowledgements of receipt to the board. The CMS 1500 forms and narrative attachments received by the board will be combined and displayed in the applicable injured workers case folder. Please note, when CMS 1500 forms are submitted to the board using the electronic submission process, providers should not send a duplicate paper form to the board. So as I just mentioned, we do want to kind of briefly highlight some more benefits of electronic submission. First and foremost, providers typically get paid quicker. When providers submit CMS 1500 forms electronically, the electronic submission partner will submit to the insurer and to the board, like we just went over. Providers will have confirmation within 7 days that their bill was accepted or rejected by the insurer. With acknowledgement of receipt from the insurer, the provider is aware that they should not resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. And lastly, as we previously mentioned, submitting electronically makes the billing process much easier for you. There is no need to submit the CMS 1500 form separately to the insurer and the board, and there's no more paper. We do want to stress, though, when the medical narrative template is used, providers must attach a narrative report with clinic visit history examination findings, including the history of the injury or illness, any objective findings based on the clinical evaluation, diagnosis and assessment of the patient, and a plan of care. And we do want to just note that this really is no different than the minimum standard of care requirements for documentation of any clinical encounter, whether it be workers' comp or non-workers' comp related. The board has developed a medical narrative report template that can be used to create the medical narrative report, that accompanies most provider submissions of the CMS 1500 form. The template includes the three elements to include with the narratives, which is the patient's work status, causal relationship of the injury or illness to the patient's worked activities, and the temporary impairment percentage. It is imperative for providers who are expected to do so to include these three elements to ensure the workers receive the treatment and indemnity benefits they are entitled to, and for prompt payment to the provider. Medical narrative report may be found legally defective if these elements are missing. However, insurers should not use this as the sole basis for non-payment, especially, for example, if an injured worker with a long-term condition is not working, is at MMI, and has an unchanged level of impairment, and the provider simply documents clinical, occupational, and functional status unchanged from last visit. It is important to note that certain provider types are not permitted and therefore not required to provide impairment percentages or opinions on causal relationship. You can find a PDF of the report at wcb.ny.gov on the CMS 1500 requirements page under the medical narrative requirements section. And for certain types of medical services or supplies, a medical narrative is not applicable. Instead, an attachment is required. So, for example, a radiologist should submit the radiological report with the CMS 1500, and a DME supplier should submit the physician order with their bill. A full list of attachment examples may also be found on the requirements section of the website. Lastly, although Form C4.3 is not being replaced with the CMS 1500 form, the CMS 1500 can still be used by medical providers who are submitting electronically. However, there are specific guidelines which must be followed when submitting medical bills for permanency evaluations. It is very important that medical providers use either CPT code 99243 or 99245 for permanency evaluations. Code 99245 is used for examinations and reports of non-scheduled permanency evaluations, and 99243 is used for examinations and reports of scheduled permanency evaluations. When using either of these CPT codes, they should be the only code billed on the CMS 1500. A completed Form C4.3 should be attached to the CMS 1500 form as the medical narrative attachment. Finally, when billing electronically for permanency evaluations, it is not necessary to separately send Form C4.3 to the board. Our last section here is regarding COVID-19. We do want to make you aware of the resources we have been sharing with injured workers who believe that they may have contracted COVID-19 in the workplace. All incidents of new COVID-19 cases are not nearly as severe as they were a few years ago. We do continue to get COVID-19 claims coming through the system, and the information is still important to share. The board does strongly encourage workers to file a claim if they believe they contracted COVID-19 at work. However, the insurance carrier must notify the board of the incident. Workers have 2 years from the onset of the illness to file a claim, and a positive PCR test is required. And the board is holding a free informational webinar to the public on this topic on June 12th. You can visit our website in the webinar section to see that and register for it. It is free. As we continue to work on implementing improvements for healthcare providers, we are committed to increased communication with providers, such as this webinar, as well as targeted emails. We're also committed to regular engagement regarding onboard. As primary users of the system, your input and engagement in the project is very important. The board recently added a new provider toolkit to the website. In addition to sharing the latest news, this section also walks providers through everything they need to know, from getting started in the workers' compensation system to treating injured workers, billing for services, and more. Visit the board's website at wcb.ny.gov and select the Provider Toolkit quick link on the provider page. For more information on onboard, please visit wcb.ny.gov/onboard. Resources include a walkthrough of the registration process, video tutorials, and recorded presentations for providers. For more information on CMS 1500, including a list of electronic submission partners and discontinued forms, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative. That email address is cms1500@wcb.ny.gov. You can see, though, that email address does not have the dash in it. If you have provider-specific questions, you can call our helpline at 800-781-2362, or you can email mdo@wcb.ny.gov. You can also find the latest provider updates on the board's website by going to our website and selecting the Provider Updates quick link on the top of the provider page. You can also stay informed by subscribing to get board notifications straight to your inbox at wcb.ny.gov. Just scroll to the bottom of the page and select Get WCB Notifications, and you get to choose the topics you'd like to subscribe to. You can also follow the board on X, Facebook, Instagram, and YouTube for board news, project updates, trainings, and more. I do want to note that this presentation will be edited and posted on our YouTube page when it's completed. You'll get an email notification when those are up and ready. So again, make sure you are signed up for email notifications. So that does it for this presentation. I want to thank you all for joining. As promised, we are now going to spend the rest of the time answering any questions you have.
Thanks, Adam. This is Dr. Tachi, everyone. I'm going to jump in to answer the first few questions that came in while Adam was talking, and then the other folks from the MDO will probably start reviewing some of the questions that are coming in now and have some answers ready when I'm finished. So the first question was basically, can you give me some tips on how to get medications approved in the onboard system? And I think that the first part of that answer, before we get into that, is that a significant percentage of medications probably should not require a PAR or prior authorization request anyway. If they're recommended by the MTGs, and their MTG and body part are in the formulary, and the medication is indicated as recommended within the formulary, and our formulary reflects our medical treatment guidelines, and they're in an appropriate phase. And folks who are familiar with our formulary, it's broken into phase A, phase B, perioperative, etc. A significant percentage of the medication PARs that we see did not ever require a PAR in the first place. You can simply write the medication, state that it's recommended in the medical treatment guidelines in the formulary, and there should not be a PAR requirement, and that in turn then wouldn't slow down the process. And then directing an answer to the specific questions that came in, with respect to sort of getting those PARs that are required approved for medications, it depends on why the PAR is being requested. If you're requesting a medication that doesn't fit into those categories, that does not fit in, it's either not recommended in the MTGs, or maybe it's a second line medication in the MTGs, or it's not in the formulary, etc. Then you have to include in your PAR your clinical basis or your rationale for why the patient needs the medication that you're requesting, as opposed to the medications that are either recommended as first line or that are in the formulary. And that happens all the time. That you can't anticipate every clinical situation in the medical treatment guidelines or in the formulary. And if your patient represents an exception, you just have to explain that exception. The second scenario might be when you are requesting a refill for the medication beyond its, say, initial prescription. And for that, you simply have to articulate, A, that the medication is working, B, that the patient's clinical status is such that they still need that medication, and C, you might want to include, and they're not having any adverse side effects, etc. And so for these reasons, even though we initially thought the medication might only be needed for a week or a month, et cetera, it may be needed longer. And those are the main points that we would make in terms of prescribing medications and having them approved. A second question came in that actually we specifically won't be answering in this webinar, but it had to do with how long does it take for a provider to be reinstated after they have, for whatever reason, either resigned their authorization or lost their authorization with the comp board. So on occasion, providers will voluntarily withdraw from their authorization from the comp board, or on other occasions, it's not a voluntary withdrawal and their authorization is lost. The reasons for those circumstances where the provider might lose their authorization are on a case-by-case basis, and usually they involve somewhat sensitive information with respect to the provider. So we don't answer those questions in a forum like this, but the person who submitted the question. If you email the medical director's office directly, we can respond to you directly. And having answered those first couple of questions, I will turn it over to our staff that have been looking at the questions that have come in while I've been talking.
Hi, this is Audrey Cunningham. There was a question that just came in regarding delegate submission. So now with this new enhancement, if you as a provider did delegate someone within your office to submit that prior authorization on your behalf, that delegate, if he or she is assigned by you and signed up within the system, can submit on your behalf. There is an attestation indicating that the delegate is submitting the prior authorization request on behalf of the provider.
I see another question that came in that looks like it's related to the DME fee schedule, and if you are, it looks like, do you still have to, as you had to in the past, attach invoices? And typically, if something is in the fee schedule, if something is in the fee schedule and you're billing at the fee schedule, then that should be sufficient for what the bill is. You don't have to provide what the dollar amount is of what you're billing.
So there's a question here regarding prescriptions and therapy, and I think your question is quite often the adjusters deny or do not respond to prescriptions or therapy that are within the MTGs, or so PAR submission is our only option. So the confirmation PARs, that if you're referring to confirmation PARs, those are they are optional. It is unfortunate if adjusters are denying without this confirmation PAR, but yes, your option is to submit a confirmation PAR if something is within the MTGs. You certainly do not have to. If you have ongoing problems with particular carriers, certainly let us know, and we can forward that along to the appropriate compliance area.
And then I would just add also, if you've provided that service, or if you want to provide that service, so if something is clearly recommended, you in the MTG for that body part, for that diagnosis, and the therapeutic intervention is clearly recommended, then, as Audrey just mentioned, a confirmation PAR is purely optional on the part of providers, and if it's submitted, the carrier has to respond. But if you don't submit a confirmation PAR, and we encourage people for things that are recommended in the MTGs not to submit a confirmation PAR, you can go ahead and deliver that service, then deliver the service. And if payment is denied, which it shouldn't be, it should be paid, then as part of that bill dispute resolution process, you can simply state this treatment was clearly indicated for the MTGs. It did not require a PAR, no PAR was submitted, and the treatment was delivered. So there is that pathway forward without any PAR whatsoever.
And it looks like there's one final question regarding a PAR at level 2 review. So you're at the requester here is asking about peer-to-peer reviews, but if your PAR is at level 2, just to reiterate, if it's at level 2 and it has been denied, that's at that point is when you can request a level 3 review by the medical director's office. I'm not sure if that answers your question with respect to a peer-to-peer.
Yeah, so just the timeframes is if you're denied at level 1, you have 10 days to request an escalation of the PAR. The level 2 review is by a physician peer reviewer. You can always put notes and respond to requests for information by the carrier in onboard. And then if you're denied at level 2, then you should escalate to level 3, and that will come to our office. And we will review both sides of the PAR request, both the request and the denial. And as Adam mentioned in the body of the talk, very important when you're escalating to level 3 review to not only state why you think the request is clinically indicated, but also respond to the basis for the denial that the carrier gave at their level 2 denial or their level 1 denial. So tell us why you think it's clinically indicated and respond to the reason that the carrier gave or the payer gave for denying the PAR.
There's a question here regarding for any treatment and testing category, do we need to submit an MTG confirmation or an MTG variance? And that it depends on the type of treatment that you're requesting, of course. If it's outside of the medical treatment guidelines, then it would be an MTG variance. The MTG confirmations, as Adam mentioned, are for such treatment that is within the guidelines, but you can optionally submit that confirmation PAR.
If we did not get to any of your other questions, please feel free to email us directly, and we'd be happy to address them.
Want to thank you all for joining us. Want to thank the MDO team for joining us today and answering your questions. Always do a fantastic job. And before I sign off, again, I want to just reiterate following us on social media, X, Facebook, Instagram, YouTube, and then signing up for email notifications so you can get those notifications on any webinars or resources or any new news that pops up. And I do again want to thank you all for joining us today, and please enjoy the rest of your afternoon.